Hi everybody, welcome to our latest installment of Champaign County Healthcare Consumers Healthcare Fact Chat, and we are
Adani Sanchez, Client Services Coordinator.
And I'm Claudia Lennhoff, Executive Director, and today we are sort of following up on all the big activities of what happened last week with the Senate Health Bill in the budget reconciliation process. And there was a very sort of dramatic conclusion to that process at the end when late on Thursday night, Friday morning, I believe, the Senate Democrats voted no on the amendment for the skinny repeal, and they were joined by Senators Murkowski and Collins, and then dramatically by Senator John McCain, and then that shut down that process at that point in time. Today, what we're talking about, though, is budget reconciliation for healthcare really over, or is it a possibility that we could see something happen again? And then we also want to talk about something you're hearing a lot about lately, which is cost-sharing reductions or payments for cost-sharing reductions, because Trump is threatening to not make those payments. So, Adani, how about, can you brief us on budget reconciliation and whether it's really over for healthcare?
It's not over! Surprise! Spoiler alert, it's not over. The skinny bill was actually an amendment. And so what was voted on, it kind of just voted no on that amendment, but the actual underlying bill, which is the American Health Care Act, which was what passed the House prior to this, that bill is still open. That bill has not been shut down yet. So by the Senate,
okay.
Right? So that process is still open, and they can still bring up something else to be voted on with just 51 votes, or to get approved with just 51 votes.
Okay.
So that it's not over. Spoiler alert. They can still bring something up through budget reconciliation.
Well, that's terrible. But my understanding is that Mitch McConnell, when he sort of laid out the agenda for the Senate for the coming weeks or whatever, that he didn't even have health care on there.
Right. It's a little bit hard right now because they do have Senator John McCain is actually kind of still out for the count right now.
Yeah.
He came back again dramatically to kind of cast these votes and is now going back to get treatment for his illness.
So we at Healthcare Consumers, we don't really anticipate right now a bill coming up through budget reconciliation, but nothing about this process has been predictable, and we just felt that it was really important to disabuse people of the notion that it was over with that final no vote, because that vote was actually on an amendment as opposed to the underlying bill, which they were trying to change through these various amendments.
Right.
But there is a lot of other activity happening in terms of there's some bipartisan efforts and things like that. And we will actually talk about those more next week. We thought that what it would be good to focus on right now is to just talk about the cost-sharing reductions and the payments for those. And do you want to start out by explaining from a consumer perspective what cost-sharing reductions are in the Affordable Care Act and who those apply to and how they help?
Perfect. Cost-sharing reductions are discounts on health insurance plans that reduce things like deductibles, co-pays. It's cost-sharing, that's what they call it in health insurance, when that's what your responsibility is to pay. That's your part. Your health insurance pays a part and then you pay a part. And so that's considered, your part is called cost-sharing. And so it reduces the cost sharing, and if you are below 250% of the federal poverty level, which is about $30,000 for one person and about $61,500 for a family of four, you are eligible to get these cheaper lower deductibles, lower co-pays on your health insurance plans. Those payments are made by the federal government directly to health insurance companies to bring those costs down for people, and they only apply to what are called silver plans on the health insurance marketplace.
So these are for plans that are on the marketplace, and these are in addition to the premium tax subsidies.
Correct. Those are different things.
Yeah. So the tax subsidies help make the monthly premiums more affordable for people, but then you're saying that people who are below 250% of the federal poverty level, that if they're looking at a silver plan, they may actually qualify for cost-sharing reductions, which would reduce their out-of-pocket responsibility.
Correct.
Okay, and do you know what the breakdown is, for example, within Illinois, people who shop on the marketplace, what percentage or how many of them get the cost-sharing reductions?
Yeah, about half of people who are enrolled in Illinois in the health insurance marketplace get cost-sharing reduction. So it's about 149,000, so not quite 150, but about 149,000 people here in Illinois out of the 314,000 that get their health insurance through the marketplace.
Okay, so these are really a big deal. It's a really big tool for making health insurance more affordable for people, and for making sure that they are really getting sort of a quality plan, a silver plan. And so now Trump is constantly talking about that he may not authorize the payments to the insurance companies for these cost-sharing reductions. Can you talk about that a little bit? Can he do that?
The reason this is up in the air is because because Congress, the House of Representatives filed a lawsuit against President Obama when this first started, saying, like, kind of on the ground, kind of questioning the ability for the law to do this. Like, did it authorize those payments? You know, how is it possible that you're authorizing these payments? And so there's a lawsuit right now that's calling into question whether these payments can happen because Congress didn't explicitly kind of add a line item for that.
Okay.
So it's kind of up in the air right now. So it's been happening kind of at the Trump can kind of decide, President Trump can kind of decide whether or not he wants to continue those payments, because there is kind of this question in the air about whether or not it's appropriate and whether those funds have been appropriated responsibly or the way that they were supposed to be. And so this could kind of be fixed if the House of Representatives or in Congress in general
They could just withdraw the lawsuit, right?
Right. They could drop the lawsuit. They could explicitly write these funds in, and kind of appropriate them so that way it's not at the discretion of the president.
So they could fix this, and what this would mean. So a lot of people who were unhappy with the Affordable Care Act and the plans in the marketplace were unhappy because they felt that the premiums were too high or the deductibles were too high, but these cost-sharing reductions actually get at that issue.
They directly address those problems, and so you'd think that they'd have an incentive to try to make sure to keep this in here and really fight for this. We're already hearing kind of murmurs, like people are kind of publicly going on record actually and saying, oh, we really should do this. We really should continue.
Including Republicans.
Yeah. Exactly. So this is a thing that I feel like should not be very hard to get momentum on, so I really hope that.
Yeah, and so in the past, when it was the Obama administration was fighting this lawsuit.
Correct.
And then what has happened since Trump has come into office is they have been sort of just absent in this lawsuit. They haven't fought it, but they also haven't pushed it, and that has created that room for Trump to talk and say things and express his wishes, but that creates uncertainty for insurance companies.
Exactly.
So can you talk a little bit about the timeline for insurance companies as they're making their plans and how this uncertainty about the cost-sharing reductions and whether they'll be getting those payments or not is affecting the decisions that they're making?
Yeah, a lot of insurers have also come out publicly and said this is incredibly irresponsible to not make these payments.
Irresponsible.
Yes.
Okay.
Yeah, irresponsible. Yeah.
You said that. I just wanted to make sure everybody heard that.
So this summer, health insurance companies have kind of put forward their products. They've said this is how we're going to kind of price them. But again, without knowing this, there's kind of uncertainty there. So they're hoping that they don't have to ultimately change their prices to make up for how certain people under 250% of the federal poverty level might now not be able to afford those silver plans that they're putting on the marketplace. So on September 27th, health insurance companies are going to have to actually sign those final contracts that include that kind of set everything in stone a little bit. Okay. And so that's kind of going to be the day that we're looking at. But continuing or cost sharing reduction payments are still need to be made. So there are still these like deadlines that kind of come up every month, and the president is kind of making it very difficult for health insurance companies to know whether, are we going to have these payments next month?
Right.
So it's kind of putting that into question. Kaiser expects premiums to go up 19% if the president comes out and says that they're actually not going to fund the cost sharing reductions. So it's going to be very problematic if this doesn't get funded.
Well, and locally in our community today, there was an article in the paper about Health Alliance and Blue Cross Blue Shield and the premium increases that they have requested for their marketplace plans. Now, these are not the final. They still have time to change depending on what happens. But they were definitely double-digit, way up there increases. There was sort of a range of them, but I think one of the highest increases was 40-some%, and it's all because of the uncertainty about how to price the plans because of not knowing if the government is going to come through on those cost-sharing reductions. So it creates a lot of uncertainty, but things may change, and there does seem to be movement within Congress to pressure the White House to go forward with the cost-sharing reduction payments, but we're waiting to hear exactly what happens. So there's a lot in the air right now. I think it's important to stay tuned. There's no repeal that's super imminent right now, but we don't feel very secure yet. We're really monitoring things and watching things. Next week we will talk to you more about there's several different
different fronts,
committees, ideas, collaborations, bipartisan collaborations even that you are hearing about, and we will talk about those specifically next week. So tune in then. And just before closing out, I just want to again thank everybody for your activism over the past few months, and I hope people just understand that with your help we averted a disaster, because Mitch McConnell was hell-bent on getting something through that budget reconciliation process, and it was not going to be good, and he pulled out all the stops, and thanks to your activism, I think that carried the day. All right, thank you.